for accidents and medical emergencies anywhere, even at the hospital, during catastrophic storms, business or recreational travel, as the result of sports or recreational injuries at school, in the workplace, or with children or adults with special needs. What would you or a loved one do if you were in an accident, have a medical emergency, or find yourself in a catastrophic situation? How would emergency medical techs know your medical and personal information? You need to take control of your health information. It's just a click away at control.health, and you can find out more with the 800 number on your screen. In this special edition, find out how to manage your health information through Control Your Health Records, powered by EMT eLink. It could save your life and that of your loved ones, and all for an affordable monthly cost. Is your life and that of your loved ones worth the price of a cup of coffee? It is. Find out on this special edition of Innovations in Health. I'm John DeShula. Welcome to the most important program you may ever watch. I'm joined by my guests, founder Dr. James Walton and Dean Massey, president and co-founder of Control Health. Dean, before we get into the dynamics of this program, tell us the personal story of your heart attack and how this technology saved your life.
5 years ago today, I experienced some unusual feeling and my heart started beating and I was in a lot of pain. My wife was watching the TV program. I was sitting on the couch, as I normally do, working with my computer. She looked at me and said, "What's going on?" And I said, "I'm in a lot of pain." So she said, "I think I'm gonna call 911. As being a man, I said, "No, I'm all right, I'll be okay. Just let me sit for a few minutes." Well, that few minutes, she had already called 911. They were knocking at the door very quickly. The first thing that they asked me was, "What kind of medication am I on?" I couldn't talk because I was in so much pain. So they looked at my wife, and she had no idea. I take about 14 or 15 pills because of the medical conditions that I have. And I got there, the doctor there was asking the same questions. They wouldn't let my wife come back into the emergency room where they had me. So I had my phone, and I just put my phone up and punched the icon, and my medical records came up, and they started looking at them.
So the Control.Health icon, which we'll talk about in this special presentation, that data, and we're looking at it on the screen right now, is there for the taking for the medical tech, and that's what information was needed.
That's what was needed. It had all my medication, my medical conditions, my insurance card, my contact, emergency contact, all the doctors that I see.
Vicki, his wife, also called us, and so a friend, Eric Chory, and I met Dean there at the hospital, and we went into the cardiac care unit, and Dean was sitting there in bed, and I said, "How you feeling?" And he said, "I'm having a heart attack." And I said, "What are they doing?" And he said, "Well, they're giving me morphine." And I said, "What are they saying?" And they said, "Well, they're talking about doing an angiogram to find out, what the blood distribution to his heart was, but they're going to do it tomorrow." And we said, "I don't think that's going to work," and about that time, the physician decided that no, it wasn't going to work, and the reason that he decided that is because he had Dean's information right there on the phone, and with all of his other medical conditions, to wait that long could have been catastrophic. And so the fact of the matter is that information that he had on his phone is what made the physicians decide to go ahead and do it. Otherwise, he wouldn't be standing here today.
And that story, Dean Massey, Dr. J, Dr. James Walton, is why we're here today to talk about Control.Health. And let's hear from some other people who have signed up for this EMT eLink and that they're here because of it.
I am 52 and have multiple medical diagnoses that require me to visit multiple medical specialists on a regular basis. EMT eLink made it easy for me and all my doctors to share and have access to my accurate and up-to-date health information. Having direct access to my full list of medications, my doctor's information, and my emergency contacts in case I'm ever in an emergency is very important to me. I am thankful to have that now.
Those testimonials, just another reason why you need to sign up at Control.Health. Dr. Walton, Dr. James Walton, Dr. J, wild weather is everywhere. no matter where you are in the country.
Yep.
It seems like storms are getting more severe, they're more catastrophic. Things just change in an instant, whether it's a hurricane, a tornado, a blizzard, a flood. And the critical information that you need at a time when you need it the most is likely during a storm in certain areas of the country.
Right.
And you have a story about a student that you worked with who really focused on the importance of this technology for those such events.
I actually have a patient in my dental practice that I had given the system to use because she's a student, doesn't have a lot of money or anything of that nature. And so when she went through it and started looking at it, she came back and told me that she had written a doctoral thesis on the psychological effects of Hurricane Michael, which was a Cat 5 hurricane that devastated the northwestern part of Florida around Panama City Beach and Mexico Beach and all of that 5 years ago. And she said, you know, my research showed that the #1 psychological result of that was the loss of their medical information and their inability to get that information from their doctor's offices or their hospitals because they had been totally destroyed. Our app and our program can solve that problem because everybody's carrying their phone. And so your medical information is there at all times when you need it. Think about folks, if you will, that are having to evacuate ahead of a large hurricane. They don't take their medical information with them 99% of the time. They don't think about that. They think about everything else. But with this program, you've got it with you at all times.
I live alone and enjoy being independent. But the older I get, the more important it becomes to have direct communication with help if I have an accident or take a fall. My EMT Link fall detection button stays with me all the time. And I am thankful it contacts my son and all my emergency contacts right away if it senses I have fallen.
How can you take control of your health information with this latest technology that we've been talking about? Take a look at this video and find out. Control allows you the opportunity to take true control over your electronic health record. Think about it. Only you know what's your most current address. Only you know who you would want contacted in an emergency situation. Only you know your allergies. Only you know what medications you are taking. A doctor only knows what's been prescribed. When it comes to your health record, shouldn't you be the one in control? Go to control.health and take control today. This important medical data information is really the brainchild of these two gentlemen right here. And Dr. James Walton, when you decided to come up with this concept, what motivated you to want to put this data bank together as founder of control.health?
So initially, it was because of my profession. I'm a dentist by profession. And one of the most frustrating things that goes on in dental offices in general is that people come in for their appointments and we're required to go through and update their medical information, what medications they're taking, any new conditions that they have. And they don't have a list of it. They say, oh, I take a blue pill or I take a yellow pill or whatever. Well, why do you take it? Well, I don't know. And so with this program, it's very easy because they can collate all that information and have it on their phone. They come into the office and simply hand it to the technician. This actually happened with me in an emergency room situation where I was in there with an extreme case of diverticulitis, and like Dean, and when he had his heart attack, I couldn't speak because of the pain, and the young lady came over with her cart and she wanted to know, well, what medications are you taking? And my head was spinning and I could hardly see from the pain, and I handed her my phone and she looked at it and she said, where'd you get this? And I said, well, we're developing this. And she said, this would be highly useful to all of us in the medical field.
Because as you've seen as a dentist in your medical profession, if there's errors in the medical information all the way down the line, that could result in catastrophic situations, the wrong medication, the wrong surgery.
You can go back and look at the history of medical errors. Tens of thousands of medical errors occur every year, and the majority of them are medication related.
So this technology really makes it precise for the medical tech. So Dean Massey, as an IT guy and been in the technology field for decades, How did you both connect, and what did you see as the benefit for this?
I was doing the work as far as all the IT work for Dr. Walton's office, and he brought that concept to me, and we started looking at it, and I decided that the first thing that we needed to do is have it where it's HIPAA compliant and the data secure in a secure place.
So you bring up a very important point, and not only is the data safe, it's secured, and it's available really from all over the world because of this technology.
That's correct. Everybody that has a phone, they change phones frequently, or the computer dies, but the data is not on those devices. It's the app and the program that goes to the cloud and gets the information.
The medical information that you're securing in the Control.Health EMT E-Link is something that may already be duplicated at the primary care physician for the patient, but you can't always get to that primary care. I have a portal that I use with my primary care physician, but there's a password and a code, and
Correct.
in the middle of an emergency, that's going to be an impossible task to do. So this makes it immediate.
You push the button, and up it comes on the phone.
On our portal, we have a document section, and in that document section, you can send to the portals that you have at all of these specialists that they will provide us the data as far as your medical record, and it's housed in our portal. So you can go to the doctor and you don't have to go back to the primary or the secondary and get that information. It's residing in our portal.
So all of this now, we talked about technology on a computer and a phone. Show us, gentlemen, because I know you're card-carrying members of the EMT E-Link Control.Health plan. You have something very interesting. Dr. J, show us your card. We'll talk about where you can get the card. And Dean, you have something on the back that's very interesting, a QR code.
So whenever the EMTs get to you, and if your phone is destroyed in the accident, they can just pull up their phone and shoot this QR code, and that medical record will come up on their phone so they can have the information.
This same information is available if you're uncommunicative and you're going into the emergency room at the hospital and nobody's with you, then here's your medical information, and they can scan it. Now, whether or not they will is up to the hospital, but it's available for them. Your physicians prescribe medications for you, but they don't know whether you're taking those medications or not. The only person that actually knows that is you. And so you're the one that can provide the accurate medical information in time of emergency. It's easy and simple. In fact, you know, when we started this, and you'll probably bring this up later on, but when we started this whole program, the only thing I told Dean was that it had to be easy enough for me to do it.
Well, we're going to talk about that in just a little bit, Dr. J, because as somebody who is also challenged with technology, maybe some of you are as well, don't feel intimidated by it. In fact, technology, it's changing all the time, and the EMT E-Link, which has been available since 2021, has exclusive technology, and let's find out how it works. You can access control from any device, whether it is your smartphone, a tablet, laptop, or desktop computer. We encourage you to use your smartphone primarily, since you will need to access your camera on the phone to take photos of items like your insurance card or driver's license. You'll learn how to set up the system with your information, how to change your information, how to add and edit emergency contacts, upload identification cards, and access your medical records. It's important to note that you should update your records regularly with any changes to your personal or health information as they occur. That way, you'll always have the most accurate information available to share or be accessed. In the event of an accident, for hurricane disaster readiness, to check in at a hospital, or even just to update your physician, reduce the need to fill out paper forms. Let Control be your medical advocate. Let's get started. So continuing on how you would log in from your cell phone, Dean, show that with this example.
Well, to go to the portal, you just have to go to the little lines here, and a menu will come up. And that's where you would go to sign up, or you can go to the portal itself.
So click sign up, and let's see what pops up. And there it is, the same thing that we saw on the laptop. And you'd make the decision as to what program you would want. And just raise that up a little bit, and you'll see that the same applies. You see you can sign right up, click that button, and there's the information all at your fingertips on your smartphone. That's a very important piece of this, the family part, because I have a daughter. She can have my information, I can have her information. And we talked, Dean, about the technology on the cell phone and on the computer, but Dr. J, you have it on an app as well.
That's correct.
And show that up, hold it up close so we can see it. You can share that information as well, right?
That is correct. I can hit the share button and it'll bring up either fax or email, and you can fax that information then to other physicians or whatever you would like. There's also an emergency button on there that you can hit, and it will notify your emergency contacts about the fact that you're in distress.
That's important information. So we see the button that says share, view, and notify. So that app can actually make that notification.
That's correct.
To 911 personnel in your area.
Correct.
So we talked about how the technology is sophisticated with the app and online, but the app is easy to load and use. Let's take a look. Getting started with the Control app. Once you have downloaded the Control app from the Apple Store or Google Play Store, tap on the app icon on your smartphone. Log in using the same login and password that you use when using the Control website. You will remain signed into the app until you log off by tapping Log Out in the menu at the bottom of the app screen. Within the app, you can share your medical report, view your medical report, and use the Emergency Notify Contacts feature. To enable the Emergency Notification Contacts feature for future use, tap Settings from the menu at the bottom of the screen. Your emergency contacts will display. Tap the checkbox beside the name of each contact that you would like to receive a text message when you click the Notify Emergency Contacts button during an emergency situation. Next, select who you would like to receive a phone call when you click the Notify Emergency Contacts button. You can choose one of your emergency contacts, or you can choose for no one to receive a phone call by selecting the Do Not Call Anyone option. Tap Refresh to save your changes. You will see a notification that the information was updated successfully. To make updates to your medical report, tap Medical Report in the menu at the bottom of the app screen. You will be automatically redirected to the Control website in your browser, where you will be asked to log in. We take our responsibility seriously for keeping your data safe and secure, redirecting you to the Control website, where you will enter your login credentials to make changes to your medical report, maintaining our compliance with HIPAA regulations, and ensuring the security of your data. Here are 5 reasons why you need to call the 800 number on your screen and log on to control.health to store your life-saving medical information with important insurance data, emergency contact information, where it is safe, secure, and affordable. Dr. J, let's talk about that affordability and the programs. Sure. We saw a little bit in the technology segment about what's offered, and I know that for $4.95 you have a very basic plan. What is that?
So that is the app. You get the app for that, and all that goes with that, your ability to collate all of your medical information, send it to your physicians. You have the emergency portion of it to send to the triage center. All of that's included for $4.95 a month. Which, you know, as we talked about, is the price of a cup of coffee. Yeah. Now there's another level at $5.95 a month where medical records are also stored. What's the difference with that one? So the difference is you get the medical emergency card, the e-card along with it. And that allows first responders to be able to access your medical information as rapidly as possible in an emergency. And as you have seen earlier, I carry that next to my driver's license because that's what they're going to be looking for in there. So you get that for $5.95 a month. So we talked about the medical card and the QR code on the back and carrying it in your wallet. But if you're elderly or you have elderly parents or loved ones, their safety is of the utmost importance, and you want them to stay connected, particularly in an emergency. So Control.Health at EMT eLink offers for $49.95 a month the SOS button. It's a device similar to the ones that you've seen before, but this time your records are kept
while it also alerts first responders. And Dean, you have an example of what the SOS looks like. There it is right there. So that has a little cell phone device in it as well, right?
It's a cell phone, so people can either call you and talk to you, or you call the triage center and communicate with the triage center. So they can ask questions in terms of why are you pushing the button? And then they can decide if they need to send 911 or if they send one of their ambulatory services.
And you can wear that around your neck, you can wear it on
around
your belt.
neck, on your belt.
And if people aren't responsive, then those people on the other end will know to call 911.
This has a GPS location. Whenever the information is sent to the triage center, they get your medical information, but also they get the GPS location.
I live alone and enjoy being independent, but the older I get, the more important it becomes to have direct communication with help if I have an accident or take a fall. My EMT E-Link fall detection button stays with me all the time, and I am thankful it contacts my son and all my emergency contacts right away if it senses I have fallen.
Also, this has a geofencing. So if an elderly person goes outside that geofencing,
right.
It's calling the triage center to indicate that they're outside. Also for kids, this is a good thing for them to carry so you can follow them, and when they get home to a geofence, you can say that they're back home.
So that's an important point, because if somebody has dementia or they have a family member who has dementia and they go out of bounds,
right,
then that detects that. And if a child has special needs and they're off to school, you want them to have some independence, but you also are concerned about their safety.
Right.
But for $59.95, you get what's called the SOS Watch. And what does that do? It's sort of like something you see with other major companies.
Right. This is the same thing as this, but it's a watch that you wear with you on your wrist, and it has a fall detection as well. So either this or the fall detection watch would do the same thing. It would send the information to the triage center, and also some of them have the geofencing as well. So you can have that as a secure factor as well.
Is your life and that of a loved one worth the price of a cup of coffee? Sign up for the EMT E-Link with one of these affordable options. So it's almost like wearing a Fitbit watch.
Correct.
You know, so if you invest in that to see how many steps you take, you can invest in this to save your life.
Yeah, we are with Fitbit, and so on our website, we will have a place where you can go buy a Fitbit, either the Fitbit watch or the Fitbit bracelet.
Talked about these costs, and they're fairly, affordable, obviously, but there are some people who may not be able to afford it or may have some questions about whether insurance covers any of this. Is that the case, Dr. J?
So it depends on the insurance company to a great degree, and there are some companies that will pay part of it. There are some who are advertising on TV now that they will pay part of medical expenses and medical devices, and so it just depends.
I can't think of a better gift to give somebody than to sign up a parent or a loved one for this program. And I would think that that's something you would encourage other people to do as well.
Absolutely.
No matter what your age, this is important to have. And a child should have their medical records with them also. Even if they have a few dollars in their wallet, having that card would be important as well.
It's very important for everybody to have it, only because if you're in an emergency, the emergency people will know if you have medication or if you don't take medication, so they have a full record of what's going on with you.
Schools and organizations need this information as well. And Dean, you have a story to tell about a school that gathered the information for their students going on field trips.
That's correct. The school is in Bainbridge, Georgia, and the band director there has elected to use our system, and they have about 300 kids that will go on a field trip. For example, they just got back from Washington, D.C. Every student that are on that trip, they have their medical information, and before they go, they have to have that. So if you take a student out of the school property, you have to have their medical record. They carry it with them, and then if they have an incident, they have the information on the phone that they can give to the EMTs.
My name is James Sewell. I'm the Director of Bands at Bainbridge High School in Bainbridge, Georgia. EMT E-Link has worked fabulous for us. It's an easy way to keep up with the medical information for the students as well as the chaperones and the staff members. So the system makes it real easy. You can access the information right through your cell phone or an iPad. The students can use cell phone, iPad, or computer to enter the information. Now, we've had to use it a few times, and it's made it so simple to get the medical attention to the students that we need, whether it's been just to administer medication in an emergency situation or if we've had to seek medical attention. We've been completely pleased with the system, and I highly recommend this system to you as well as anybody else that's looking at it.
My parents feel good knowing that if I'm injured on the field, the emergency personnel will have access to all of my health records and emergency contacts when they scan this QR code on my helmet.
Dr. J, why is signing up for EMT E-Link at Control.Health so vital?
Well, think of what's going on in people's lives right now and what is predicted to come. The number of emergencies that are occurring now on an almost daily basis throughout the United States, whether it's tornadoes or floods or hurricanes, people's lives are devastated. And one part of that is that most of the time they have not prepared and recorded their medical information. Now it's not available for them. With our EMT E-Link and the app, people can carry that information at all times.
And Dean, this technology is available globally. It's not just here in the United States, it's available wherever the internet is, right?
That is correct. Anywhere we have connection to the internet, you have connection to the portal where you get to your information.
And you got a chance, Dr. J, to test that out once, didn't you?
That is correct. Went on FSU booster cruise and we visited Sweden and Norway and Greece and Italy, and it worked there in all those instances.
And Dr. J, this is technology that's not just for people of our age. Anybody should have this technology, and they shouldn't be intimidated, because if you and I can work it, anybody can do it, right?
That's absolutely the truth. We're trying to save lives. We're trying to make it easier for people to manage their medical information, and we've done that. We've taken the control of your medical information and put it in your pocket. You're the only one that knows what you're taking in the way of medications, and you're the ones that should be taking care of it. Quite frankly, we just want to save lives.
Well, all of this technology will save your life. Dr. J, Dean Massey, President of Control.Health, EMT E-Link, and Dr. J, founder of all of this, with your brilliant idea. Thank you very much. Now, for all of you watching and listening, don't wait until something happens to you. Is your life and medical information, as we said, worth the cost of a cup of coffee? Control your health records, powered by EMT E-Link. Get connected now. Get started for you, your family members, and friends. It's easy, it's vital, and the connection to start is on the website Control.Health that you can find on your phone, on your computer, and any device. We want to thank our guests, Dr. James Walton and Dean Massey, for joining us on this special edition of Innovations in Health.